But of course, when they're really little, they won't ever remember being poked, so that's always good.
Tradition, heritage, and family play an important part in Jeff's life. A proud Métis Canadian living in a major urban center, he wants what's best for his family's future. Jeff Ward is a business person and proud dad of 2 growing boys.
So at the health clinic where we've gotten our vaccinations, there's just a ton of information there. So for example, last week we've got our kids vaccinated, and they gave us some really handy health sheets here. So for example, this one talks about one of the vaccines we just got for my son, and it's just got so much information here in a really simple way. And these sheets are readily available there. Also on the back, they've got links to websites where I can research more, and it's a good, reputable place to start my online search. Both my parents are nurses, so it's a great resource for me to be able to kind of ask them. But also, we go see our doctor on a regular basis, and they kind of keep us informed, and what kind of shots we should be getting for our kids.
Dwayne is Jeff's dad. He recently moved to BC to spend more time with his grandchildren. He got to it, teaching young Anim how to play the drum, and shares stories from his home territory with a new generation. Dwayne worked as a nurse for years in Manitoba. He knows it's important to pass along stories of good health and bad.
My mother had polio all her life, and as a result of her having polio, she was quite debilitated.
I remember my granny, she walked around with a brace on her leg, and she kind of, limped around, and I didn't really know as a child what the deal was with that, but of course now I know that was from polio. And some time ago, she actually, before she passed away, she left me a recording of herself telling me kind of her story of what polio was like for her.
Dr. LaFontaine is a well-known Métis doctor practicing in Saskatoon. He is also a former NAHO role model.
Polio is one of the success stories of the World Health Organization and health organizations in general across the world. They've done a pretty good job of organizing a program where if any polio cases get flagged, there's whole teams that actually swoop in to make sure that it doesn't spread. So polio is rare in North America. I think there's only 3 or 4 cases in all of North America a year.
Yeah, I've had experience with people who have had these diseases from lack of immunization. That's why immunizations are so important. I got my own children immunized because of the experience with my mother and my aunt, and I wanted to make sure that they were safe. Yeah, sometimes there's some minor irritation where at the site of the injection, or maybe because of some irritation to the medium that the vaccine is in, but we didn't experience anything untoward. I know that can happen from time to time, but that is not the norm. When I was a kid, because there were so many people in our community who got the measles and the mumps and like diphtheria, polio, TB, and a large number of I know lots of people who were in the sand for TB. Those diseases were quite scary to us, because when the Caucasian people came over to North America and brought these diseases with them, the diseases decimated about half of our population. It was a worry, because the elders speak and they talk about a long time ago, and when they talk about a long time ago, they speak about how in some fairy tales they say once upon a time. But when some of the elders talk, they say when we lived in the bush, which is the same as once upon a time, because a lot of prairie tribes used to live in the bush and migrated and when they lived in the bush, that was at the time when there was all these diseases coming over on the boats. And so there was a fear about these kinds of things. And there was a fear about the vaccines you were getting, because we didn't have any doctors or nurses or medical people at all in our communities who were Aboriginal. It just didn't happen that our people made it to university. It's quite different than that now. We have a lot of fine nurses and doctors who are Aboriginal, Indian, Métis, or Inuit, and they're there. The people tend to more trust them and trust what they have to say because of them belonging to our community, and we know where they live.
Alika's ideas make waves. He was named Canada's next great prime minister by a panel of former prime ministers on a national TV show. But politics isn't what he does every day. Mostly he treats patients.
It's important for you to ask questions, but always to continue on learning. I think going to elders in the community is important as well because they have an understanding of the effects that it can have on yourself, your family, and other members in the community. And any decision you make, you should never take one source. You should always take a variety of different sources and look at it from all the different ways that we perceive information, spiritual, physical, mental, and emotional, because all those things are important in health. I've had family members who have not been vaccinated, but these are back a couple generations. As far as my own immediate family, we've all been vaccinated since we were young. With my job, I've seen certain people come in with vaccinatable diseases, and it can be pretty devastating when someone gets a severe preventable disease that vaccinations are available for, something like H-flu. You can get pretty severe complications like epiglottitis, and that can progress to possible death. About 10 years ago, seeing epiglottitis secondary to H-flu was pretty common. Now that vaccinations are adopted by a majority of people, meaning upwards of 60%, you rarely see it in the hospital anymore, and the severe complications that can happen because of it aren't seen as much in training anymore.
Living in Victoria, BC, Jeff and his wife Robin explain how they made the choice to have their children vaccinated after talking to their healthcare providers.
I don't think any kid enjoys getting a needle in their arm or in their leg. So, I mean, what was our experience like? And luckily, we've got a really great 4-year-old who is willing to kind of put up with things like needles. The needle kind of went into his arm, and he barely flinched.
I usually get information about vaccinations from the health nurse. There's a local BC health unit. Also, just talking to other parents is a great resource as well because they've taken their kids in. And like one of the tips that we got for vaccinating the baby was to nurse while the baby was getting vaccinated, so that it wasn't, they were relaxed when they were getting the shot, and that they calmed down a lot faster that way if they were being nursed while getting the vaccination. Well. And it worked really well, yeah.
I went out as fast as I could and got the H1N1 vaccination because I have children and I have grandchildren, and I did not want to get something, being older and being diabetic and all that. I did not want to catch something that I could give to my grandchildren. So for me, it was about protecting my family.
I think immunization ends up being a choice, just like anything that you can receive from our public healthcare system. And I myself make the choice that, based on my experience and my knowledge about vaccinations, that it's a good idea for me to do it not only for myself, but also for the people that I deal with at work and for my own family at home.
I'm Adam Beach, and this video was brought to you by the National Aboriginal Health Organization.